Most people who die from a heart attack never felt chest pain. That is not speculation. A study published in the Journal of the American Medical Association, analyzing over 1 million cardiac events, found that 42% of women and 31% of men experience no chest pain whatsoever before their cardiac event. After 60, the signals your heart sends become quieter, more ambiguous, and far easier to dismiss as normal aging. That is exactly what makes them lethal. The 5 warning signs in this video are the ones that get missed most often, and missing them is what turns a treatable problem into a fatal one. Before we reach sign number 3, there is one symptom on this list that cardiologists refer to by a specific clinical name. It is responsible for more missed heart attacks in adults over 60 than any other single warning sign, and most people who experience it assume they are simply getting older. You will know exactly what it is and what to do about it before this video ends. Sign number 1. Shortness of breath during activities that never used to challenge you. Not the breathlessness of a sprint or a steep staircase. That is expected. The warning sign is shortness of breath while doing things that require minimal physical output. Walking from the bedroom to the kitchen, carrying a light bag of groceries, standing up from a chair and trying to hold a conversation at the same time. This symptom is called dyspnea on exertion, and it is one of the earliest and most consistent warning signs of heart failure. It occurs because a weakening heart cannot pump blood forward efficiently. Blood backs up into the pulmonary veins, the vessels that carry oxygenated blood from the lungs to the heart. That backlog causes fluid to accumulate in the lung tissue, compressing the air sacs and making each breath feel like it is working against resistance. A study published in the European Heart Journal followed over 22,000 adults across a 12-year period and found that unexplained shortness of breath with exertion was associated with a 4.4-fold increase in the risk of cardiovascular death, 4 times the baseline risk from a symptom that most people in this age group attribute to being out of shape. The distinction your doctor needs to make is whether the breathlessness is cardiac or pulmonary in origin. 2 tests can answer that definitively. The first is an echocardiogram, which gives a real-time image of how the heart chambers are moving and how well the valves are functioning. The second is a BNP blood test. BNP, brain natriuretic peptide, is a protein the heart releases under mechanical stress. Elevated BNP in the absence of lung disease is a reliable early marker of cardiac dysfunction, and it can be detected years before symptoms become severe. Therefore, if you are noticing that physical tasks you managed easily 2 years ago now leave you winded, that change is a reason to schedule a cardiology appointment this week, not a reason to push through it. Sign number 2, swelling in the ankles, feet, or lower legs that is worse at the end of the day and gone by morning. This symptom is called peripheral edema, and it is one of the most underreported warning signs of heart trouble in this age group because it looks so unremarkable. People assume it is from standing too long, from heat, from a long car journey. And sometimes it is. But when the swelling is bilateral, meaning both legs and feet swell equally, when it puts on pressure, meaning you press your finger into the skin and the indent holds for several seconds, and when it is consistently worse at night and resolved in the morning after lying flat, those 3 features together point toward the heart rather than a mechanical cause. The mechanism is the same as shortness of breath, but expressing in a different location. When the right side of the heart fails to move blood forward efficiently, pressure builds in the venous system. Fluid leaks out through the capillary walls and into the surrounding tissue. Gravity pulls it downward into the lowest point of the body, which, when you are upright, is your ankles and feet. An analysis published in Circulation reviewed clinical data from over 40,000 patients with confirmed heart failure and found that peripheral edema was present in 67% of cases at the time of diagnosis. It was also the symptom that patients had been living with the longest before seeking care, an average of 11 months before a diagnosis was made. That 11-month window is the difference between catching a problem at a manageable stage and catching it in crisis. Sign number 3, fatigue so profound it does not resolve with a full night of sleep. This is not ordinary tiredness. Ordinary fatigue improves with rest. The fatigue associated with early cardiac dysfunction does not. You sleep 8 hours and wake up exhausted. A nap provides no recovery, physical or mental. Exertion that used to be manageable leaves you depleted for hours afterward, and the depletion feels disproportionate to what caused it. The mechanism is reduced cardiac output. When the heart is not pumping efficiently, the muscles, the brain, and the peripheral organs receive less oxygenated blood than they require for normal function. The body compensates by quietly redirecting blood flow toward the vital organs and away from non-essential tissue. That prioritization leaves the skeletal muscles chronically underfueled, which is experienced as persistent, bone-deep exhaustion that no amount of rest corrects. A study published in the Journal of Cardiac Failure found that fatigue was the most commonly reported symptom by patients with newly diagnosed heart failure, documented in 94% of cases. It was also the symptom most frequently attributed to other causes by those patients before the cardiac diagnosis was made. Age, stress, poor sleep, and depression were the most common explanations people gave themselves while their heart function was declining. The specific feature that distinguishes cardiac fatigue is its disproportionality. A short walk should not require 20 minutes of recovery. A conversation should not leave you needing to sit down. If the exhaustion you are experiencing is consistently out of proportion to the effort that caused it, that pattern is the signal, therefore do not accept it as a normal feature of this decade of life. It is not. Sign number 4. Pain or discomfort in the jaw, neck, left shoulder, or left arm that appears without a clear physical cause. This is the clinical term, referred pain. It occurs because the heart and the upper body share overlapping nerve pathways through the vagus nerve and the cardiac plexus. When the heart is under ischemic stress, the pain signal travels up through those shared pathways and registers in areas that use the same nerve supply, including the jaw, the neck, the left shoulder, and the inner surface of the left arm. The brain interprets the signal as coming from wherever the nerve terminates rather than from its true source. This pattern is responsible for more missed heart attacks in adults over 60 than any other single symptom, not because the symptom is uncommon, but because it is consistently misread. People visit a dentist for jaw pain that has no dental explanation. They take anti-inflammatory medication for a shoulder ache that comes and goes. They attribute the discomfort to how they slept. Meanwhile, the underlying arterial narrowing continues. A paper published in the American Journal of Cardiology analyzed over 700 patients presenting with confirmed heart attacks in patients over 60. Jaw pain, neck pain, and shoulder pain in the absence of chest pain were documented in 38% of women and 22% of men. Among women who died before reaching the hospital, atypical presentation with no chest pain was recorded in over 60% of cases. The feature that distinguishes cardiac referred pain from a musculoskeletal problem is straightforward. Cardiac pain is not worsened by pressing on the area, moving the joint, or stretching the surrounding muscle. If you have jaw or shoulder discomfort that has no mechanical trigger, does not respond to position change, and recurs in episodes without explanation, those features together require a cardiac evaluation, not a heating pad. Sign number 5, palpitations, or a persistent sense of irregular heartbeat, particularly if they are new or have recently changed in character. Not all palpitations are dangerous. Occasional single skip beats are extremely common in this age group and are usually benign. But there are 3 specific patterns that require immediate evaluation. First, palpitations that last more than a few seconds and arise without a clear trigger, such as caffeine or intense exertion. Second, palpitations accompanied by lightheadedness, breathlessness, or chest discomfort of any kind. Third, a rhythm that feels sustained and chaotic rather than a single occasional skip. That third pattern is the presentation of atrial fibrillation. Atrial fibrillation is the most common serious cardiac arrhythmia, affecting over 6 million Americans and increasing sharply in prevalence after 60. A study published in the journal Heart found that adults over 65 with undetected atrial fibrillation had a 5-fold higher risk of stroke compared to those in normal sinus rhythm. The mechanism is that an irregularly contracting atrium does not empty completely with each beat, allowing blood to pool and clot inside the chamber. When those clots dislodge, they travel directly to the brain. Atrial fibrillation is entirely silent in approximately 30% of people who carry it, but in the other 70%, palpitations are the first symptom that surfaces. The diagnostic test requires nothing more than a standard 12-lead ECG during an episode, or a 30-day heart monitor worn at home. If you have experienced any of the 5 symptoms in this video in the last 30 days and you have not had a cardiac evaluation in the past 12 months, call your doctor today and ask specifically for an ECG, a BNP blood test, and an echocardiogram. Those 3 tests together give a complete picture of your heart's electrical activity, its mechanical function, and its current stress level. That appointment could take less than an hour. The cost of not making it can be everything.